And now let us move to today. As you can see, we are going to start speaking about instructions and procedures that are done to treat the patient or to do some investigations, the tests, medical tests. And so the instructions to the medical professionals that they should follow while carrying out these procedures. And first, we start with some comments on the previous homework. You remember that you were given the task to watch a video episode and complete the chart with the information from this video. Everything was okay, but well, I mean that some students just didn't understand, missed some information. Well, and this is about the symptoms that the patient experiences. There you can see some screenshots from different students' papers, and for example, one of them writes soft throat. I mean that he understands that there was something wrong with the throat, but why didn't you consult the dictionary? So it's easy. The task was not very long and complicated. So I could understand the soft throat because it's the student sees where the pain locates the location of the pain, but the other students writes like source food. It's not about the parts of the body. This is wrong, of course. So as you see, you remember that should be sore throat. This is very common symptom that a lot of people experience when they are sick. Well, so these are my comments. All the other information was all right. Do you have any questions about the homework? No questions?
I think no.
I see. And well, I forgot. Yes, this is the 24th of February, and we need to write who has come to the class. Selina, are you here?
Yes.
Okay, Lina. Okay, Mazir.
I'm here.
Good. Abdullah.
I'm here, miss.
Good. Then Yasmin.
I'm here.
You are here. Busaina.
Absent.
Absent. Is she on her way to Kazakhstan?
No.
I see. Okay. Ayham, you are here. Kadum.
Yes, doctor.
Denis. Denis,
Yes, I'm here.
have you solved your problem with Moodle? Do you have
At least I have just to get access to Moodle.
You can get access.
Yes, I can get access.
Okay, so have you seen the home assignments on Moodle, Денис? Домашнюю работу видели? Вы должны их сделать. Сделать сегодня. Сегодня тест напишите, сделайте тест, и если вы хотите получить хоть какие-то баллы, пожалуйста, сделайте.
Да,
Well, so Khalid is busy somewhere. He wrote me busy, and Khatab,
Yes, I'm here, miss.
Have you solved the problems with Moodle?
Yes, and I literally solved it and send you screenshots for it.
So you can just take the test on Moodle, right?
I will try, yes.
Okay, great.
Thank-
Well, now let us just move to our first slide of so from the unit 3 of the course book, and here you can see the pictures illustrating some events, some activities from of the doctors and medical professionals in a hospital. And the question is, what is happening in each picture? And what do you think happens before and after? In picture A, Lina, can you comment on picture A? What is there?
I think it's a doctor ushering a patient into a room to change into the clothes they wear whenever they have to do medical checkups.
Okay. So, and what happened before this? What do you think?
The patient and doctor probably had a conversation about what exactly the patient's complaints was.
Yes. Great. And you can see that the doctor is holding some kind of piece of clothes in his hand, and this is, he offers the patient to undress and to change the clothes. You're right. So to make it easier for the doctor to do the checkup. Okay, thank you. And now let us move to the next picture. Picture B, Mazir. What is happening?
The doctor's writing, I think she might be writing a prescription or something for a patient right now to go in his record book.
Okay.
And I'm assuming what happened before was she talked to the patient and like identified like what was going on and is now just like logging it for like future reference.
Okay, so maybe this is the end of her shift, and because of, we can see a lot of paper just on the table. Maybe these are the case histories of her patients, and she's studying and just doing something with them. Okay, great. Now in picture C, so Yasmin, will you comment on picture C, please?
I think it is like they're doing a CPR or a procedure, like doctors explaining to someone the procedure.
You can see that one of the doctors is a little bit elder than the others. He's elder anyway, and he is showing the junior doctors how to carry out this procedure, and what will happen then after the professor, for example, has taught the junior doctors. What will happen then?
I think he'll ask them to repeat what he did or what they understood of him explaining to them.
Yes, to repeat the procedure. Yes, to show how they understand so the sequence of actions. Okay, and so on the next slide there are 3 more pictures. The questions are the same. What is happening in pictures, and what happens before and after this situation? And let us listen to Ayham. In picture
Victor, for picture D, it looks like the doctors and this man who wear the suitcase, the formal suit. It is they come to visit the patient after the surgery or something like that to check about his health.
And there are several doctors, right?
Yeah, there's 2 doctors and this one who wear the formal suit.
Okay, and so maybe one of them is specialist, yes, like a consultant. So, and where are they? These people?
They are in the room in the hospital because there is these things that behind them.
Mhm. Right, yeah. Mhm. Okay. So, and they are smiling, just showing the patient to be positive, right? To
Yeah,
encourage
they
him.
they looks like they talk with him in the positive way to make him follow the energy and not be opposite or something like that.
Okay, yes, great, thank you. Well, the next picture, picture E, is for Kadum, please.
Yes, it's this junior doctor like said to another doctor to have like a blood test or like this after going out for the patient.
Yes, one doctor is holding some papers, maybe with the results of the test, and yes, maybe the doctors are discussing the
Think about the patient.
the patient, his case. Yes, great. And well, then the last picture F is for Denise. Denise, hello.
Hello, I hear me? I have
Okay, yes.
something was connected.
Picture F, please.
Okay, the picture E or F?
F.
For the picture after that man is I think it's the colleague after the work I think he and his working and discussing with colleagues about medical case,
Mhm.
but
Yes.
he's so tired and want to go home, but he's tired, but his colleague is, I think, it's just beginning the work.
Exactly, yes. So this is changing the shifts, and the doctor, so who has finished the shift, he is showing some case history, some information about the patients and what happened to them during his shift. They're discussing it with the doctor who has just come to the hospital. Great, so well done. Thank you. And there is information here about the meaning of this word, ward. So when we were speaking about general practitioners, who remembers what do we call the room where general practitioner meets his patients? General practitioner. What's the name of this room? Is it a surgery? Yes.
No.
Yes, it is a surgery. In the United Kingdom, it's called surgery or office. And here there is information about a ward. A ward is a separate room in a hospital, typically one allocated to a particular type of patient. It's not in a clinic, it's in a hospital where patients stay for longer time. Let us think of your own experience in a ward for the first time. Have you ever been in a ward? And why did you get there? What did you feel? And so who can tell us about your experience in a ward? Who has been there? Yes, Denise, please.
Okay, about my experience of being in a ward, I think it's I want to say about two sides. First, like a patient, second, like an assistant. When I was like a patient, I had concussion, so I lay in a ward more than 10 days. So what my experience, what I feel, actually it was boring. Boring. The first, the second, very early waking up at 6:30 a.m. It's so terrible for me actually because I'm old. A lot of procedures like syringe injections, drop injection, and but the main time of being in hospital, it's were nothing to do.
About being an assistant in a ward as professional. Why did you get to, why did you work for a hospital?
Yes, not work is it was last university practice in angular anteroid surgery department in another city. So what
as professional, as an assistant, how did you feel? Did you feel confident? So did you feel like you were able to help the patient?
At the first time, I don't was confident, but my leader, the main doctor, helped me for something situation. He got some instruction how to talk with the patient, how to get to build the patient, for example, and the my main thing of me to talk with the patient and repeat this compliment to to elder doctor and
So
discussing
the patient, yes, repeated his complaints to the doctor. Okay, I see. Thank you for sharing your experience. It's very interesting. And you've said about a very important thing that so to help a junior doctor to feel more comfortable about treatment of the patient, the senior doctors give instructions how to behave, right? And we'll be speaking about this today. So one more phrase we should remember, this is ward round. That is what is shown in one of the pictures. So the ward round is a visit of a doctor in a hospital to each of the patients in a ward. This is a ward round. And this picture D, this is, they are doing the ward round. The ward round is done normally in the morning, and the doctors just give instructions to nurses at this time, and so they watch the progress in treatment of the patients, and so they make important decisions during this ward round. And instructions. Here are some tips for a first ward round that can be given by a senior doctor to junior doctors, the doctors who meet the patients in a ward the first time. Let us look at these tips and answer the question, why do you think each tip is given? Why is it important? Well, let us listen to So, Khattab, please. Read the first sentence.
There are tips for first ward round. Why you think each tip is given? A, make sure you know the names of your patient and where they are. B, find out.
Just let us comment on A tip, tip A. Why do you think it's important to know the names of your patients and the location of the patients?
Of course, very important. So the patient will feel comfortable
Mhm.
at first, and very important to speak with the patient.
Yeah, right. So the patient will see that the doctor really cares of him. Mhm.
Yes.
Okay, great, thank you. Now, Lina, tip B, read it, please.
Find out from the bed managers if any patients have been moved and to where.
Why? Why should we do this? Before. Mhm.
In order to do the ward rounds, you'd have to know where exactly each patient is, and asking the bed managers, because they're the people, they're probably responsible for locating the patients. You'd have easier access to them, for example.
Mhm, mhm. Okay, yes, right, perfect. Mhm, great. Well, the next line is for Mazir. So what can you say about this?
Okay, check that all the case notes, investigations, and so on are on the ward. I guess because you have to because case notes and things like that are like follow-ups with patients as well. So you kind of need to know the state of your patient when you're going to see them. Like if there's been any updates, any changes in their health or their tests that have been done, results.
Exactly. Mhm, good. Thank you. Now line D is for Abdullah.
Yeah, so we should invite a nurse who knows your patients to come on the ward rounds,
Mhm.
because the nurse it's make some records of the cases and check their results. So it's know the patients better from the doctor. Yeah, and it should be there to give the doctors what the nurse what the patients suffer from, to give them the true treatment. Yeah.
Yes. Right. So doctors prescribe some medications, some procedures, and actually a nurse is the person who carries out these procedures and gives the medications to the patient, and she watches the progress in the state of the patient, some changes, you're right, and she
Yeah.
knows sometimes the patient better than the doctor. And
For sure.
so thank you. And now the next person is Yasmin. Will you comment on E sentence?
Okay, so record case histories and results clearly and concisely, to like know why does this patient have this disease, what has caused this disease.
Mhm. So this is about recording, writing some information in a form in case history. Why should be written clearly and concisely? Whom can it help? So these recordings.
The doctor, so we could know.
The other doctors, right? Yeah. So because different doctors just deal with the patient, and so you can, if you write it clearly, so the other doctors can easily understand what is written about the state of the patient and how to about the treatment, how to treat the patient. Well, great. And so if we
Unit 3
to the next slide, we can see so there are we are going to listen to how the doctor comments on each of the tips. And we should listen and complete the reasons given for each tip, and we should use no more than 5 words for each gap. It means we have the same tips as on the previous slide. For example, the first tip was about knowing the names of your patients and where they are, as you want to demonstrate that you are. And when we listen, we should write several phrases here. I mean that we should write the phrases after each statement here. Now we are going to listen, and you'll tell me if you can hear.
Unit 3.
Can you hear?
Yeah, miss.
Okay, now.
Listening 1.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you, because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
And now let's listen for the second time just to understand all the details.
Unit 3. Listening 1.
There are many things that will become obvious once you have done your first ward round, but I can give you a few tips that helped me on my first day. The first thing is, make sure you know the names of all your patients and where they are in the ward, as you want to demonstrate that you are familiar with your patients. The next tip is always check with the bed managers if any patients have been moved, and if so, where to, in order to avoid wasting time, especially the consultants, running around looking for patients. Also, make sure you have all the case notes, x-rays and so on hand so that you can refer to them quickly. It is useful to invite a nurse who knows your patients to come on rounds with you, because they may be more knowledgeable about the patients on the ward than you are. As regards the case histories and results, record them clearly and concisely. In that way, you can access information easily.
Now, let us check what we've written. Ayham, what did you write in line A here?
For A, she mentioned that as you want to demonstrate that you are familiar with your patient.
With your patients, exactly, good. Well, so Kadum, line B.
B, to avoid wasting time running around looking for patient.
Especially the consultants running around looking for patients.
Yeah.
Okay, Abdullah, please.
Yeah, so that you can maybe refer to them quickly, as she mentioned.
Yes, so refer to them quickly. This is about, what is it about? See, about case notes, investigations, and she says also about X-rays, etc.
Yeah.
Okay, good. Now, Madir, please, the next line.
Part E, right?
D.
Oh, D. Because they may be more knowledgeable about the patients on the ward.
Then you are. Yes. Now this is about whom? Who is more knowledgeable?
The nurses.
The nurses, right? And well, Ayham, please.
So E, it's about the writing the case easily and cleverly. In that way you can access information easily.
Yes. So this is just for us to remind, so what should we focus before the word round? Yes, to be more successful. And then let us move to the next slide. The question, would you give the same tips to a junior colleague in this situation, or what additional advice would you give? So do you agree with these tips, or can you add some other piece of advice to these tips? Hello?
So about to give the same steps to the junior college, yeah, because it will be easy for him to recognize and do them easily. Because if I give him new steps and something like that, it will be difficult to do them with these steps.
So you agree with the tips that we just discussed, right?
I'm not agree 1%, but for the junior college, it will be easy for him, these steps for the junior college. It's easier for him to do it.
Okay. Anyways, so most of you are not very experienced in just medical practice, so maybe these tips are good for you, just and very useful for you. Well, and yes. If we speak about just medical procedures that are done to do some investigation or some tests or to treat the patients, we should remember that the first thing we need to do is obtain consent from the patient for the procedure. So why do you think it's important? Do we understand what consent means, Ayham?
It's for the first one, obtain consent from the patient for the producer, because it is a legal requirement where the produce is infused, and the consent may be necessary in the writing.
COHCM, page 554, right? Yes, thank you, Ayham. So yes, this is just agreement between the doctor and the patient that so the doctors, medical professionals can do something with his body, because this is his body and he is responsible for his body himself, and he makes decisions about different kind of manipulations himself. The next is introducing yourself. Why is it important? Denise?
At the first, about introducing yourself, the first patient have to know about who will do manipulation with his body at first. Because in the case for example, emergency case like anaphylaxis, etc., patient know who name of the doctor and explain the situation. What is the doctor? What did he say? What did he do? Etc., etc. And the second part of introduction is because it's a psychological thing.
Exactly.
Because if a patient or if doctor talk about yourself, maybe about maybe more than her name. What is I am? What is kind of doctor? Don't worry, patient. I want her to help you, etc., etc. It's it have influence of calming the patient.
Yes, the patient will feel more confident and calm. Yes, so just he knows personally the person who is going to carry out the procedure. Okay, we yes, there is only yes, less than 1 minute. Let us pause